Hi, my name is Julie Lee-Tanacher, and my project is over evidence-based practice in educating heart failure patients. So I currently live in Jacksonville, Florida, and I work at the Baptist Health Hospital in downtown Jacksonville in the Heart Hospital. And right next to us is the Heart Failure Clinic. So any of our patients that have been diagnosed with heart failure are sent to the Heart Failure Clinic to manage their care and treatment outside the hospital setting. I thought this would be a great place to do my practicum so I can see my patients after they're discharged and see how they're doing managing their treatment on their own outside the hospital. So the picture on the right is a picture of the Heart Hospital and the Heart Failure Clinic where I currently was working. The learning goals that I had for myself at this practicum site was first, I wanted to know how to properly manage the care of this type of patient population outside the hospital setting. I wanted to know what risk factors I need to be aware of and how to resolve them if I encountered them, how to improve my communication skills, and how to get the community more involved. The teaching outcomes I had for this patient population was first, I wanted them to know how important it is to be educated on their disease and diagnosis of being in heart failure. I wanted them to know that it's important to be compliant with their medication regimen. I wanted to educate them on their dietary measures they needed to adhere to, what equipment they need to have at their house, certain lifestyle changes that need to be made, and lastly, I wanted them to know the signs and symptoms of their disease worsening. Why is education important for heart failure patients? Well, in a study done by Stromberg, she states that 50% of patients who have been hospitalized due to their heart failure will be readmitted within 6 months. She also states that these hospitalizations account for 70% of the total healthcare costs, and that more than half of these readmissions can be prevented with proper education, proper discharge planning and follow-up care, and also strict adherence to medical treatment. She shows that better education with heart failure can be more comprehensible. Therefore, patients with the right knowledge will have a better perception about their disease and will adopt a more self-governing role to have a better control of maintaining and monitoring their dietary regimens, physical activity, medical compliance, monitoring their symptoms, and seeking help when their symptoms worsen. Studies show that proper transition of care will maintain compliance. In a study done by Lug and Drago, they noticed that approximately 27% of the total expenditure of Medicare are from acute care hospitalizations, and that 1 in 5 of patients in acute care hospitalization settings are readmitted within 30 days, costing $15 billion in annual Medicare spending. They noticed that with proper assigned transition of care programs can improve quality outcomes in patients, as well as saving costs among government aids. In 2011, they followed a transition care program in Arizona called SunHealth, which included home visits within 24 to 48 hours after being discharged, educating patients on disease management, ensuring follow-up appointments were being met, and screening for physical and mental health deteriorations. The results from this study or program showed that only 4% were readmitted within 30 days and a 73% decrease in 30-day readmissions, which saved Medicare $214,192. The implementation I saw being made at my clinical site were that every patient with heart failure being discharged were given information or pamphlet. And the pamphlet is shown in the slide on the left, and it included all the heart failure zones. So they were educated that on their everyday routines, they needed to weigh themselves, take their medications, check for any kind of swelling in their hands, feet, ankle, legs, eat a low sodium diet, balance their activity and rest periods, limit their alcohol use, and avoid smoking. They were taught that their goal zone was to have no signs of shortness of breath, no weight gain of more than 2 pounds in a day, no signs of swelling, maintain their activity level with no signs of chest pain, and their yellow zone is the zone that they have to notify their doctor. So they're told that if they gain 3 pounds in a day or 5 pounds in a week, if they're having shortness of breath or having a dry hacking cough, difficulty breathing when laying down, or noticing they have to sleep in a chair, or having any kind of swelling in their lower extremities, being fatigued, or having chest pain or any kind of unpleasant feeling, they should notify their doctor immediately. The red zone is when they have to call 911. So they should call 911 if they're struggling to breathe, if they're having severe chest pain, or being confused. The form on the right is the form that all nurses in the heart hospital need to fill out before a patient is discharged. And all these forms need to be co-signed or witnessed either by the charge nurse, the nurse manager, or the nurse navigator on our unit. So the nurses need to follow each step-by-step check marking or putting some kind of information on why those are not being met. So first they need to make sure that there are the right orders for the patient to be discharged. They need to make sure that all consultants have signed off on the patient, saying that the patient can be discharged home. They need to make sure that the med rec has been finished and reconciled. They have to make sure that the follow-up appointments have been made and are in their discharge paperwork. And if the patient is being sent home on Coumadin, that they have a physician following up on their Coumadin and lab work. And they need to have documentation of their latest lab value, and they need to know what their goal is. So we usually write that their goal needs to be between 2 to 3. They also have to be, so if they're going home with home health, we need to notify home health agency that they're using that they're being discharged home, so that the following day that home health agency can follow up with the patient. And by following these quality core measures, this will ensure that the patient is being educated and that the right medications are being used and prescribed, and this will hopefully reduce the readmission within 30 days. At my practicum site, I noticed that there is room for improvement. In the picture on the right is a booklet that the Heart Failure Clinic gives to all their patients. In the booklet, it gives them what they need to do on a daily basis, weighing, checking their blood pressure, following their medication regimen, exercising, and how to exercise, and ideas to get them more motivated. It even gives information about their low salt diet and how to follow a 2-gram sodium restriction, and also tells them how to read the food labels on boxes and cans at the grocery store. However, the one thing I noticed that they do not touch on is fluid restriction. Working at the heart hospital, I noticed a lot of patients are being readmitted within 30 days due to fluid overload and needing to be diuresed. And I feel like if we added that into that booklet, maybe it will help cut down on those types of patients. So we talked about it, and I even got other nurses on my unit involved. So we are working on a new packet or a new booklet to give to patients. Also, we thought maybe about adding on to the physical activity. Since there's so many new technologies and apps on the phone, we thought we can give them a few ideas on how to increase their physical activity and make it more fun for them, especially with the Fitbit and having to record their steps and making it more competitive. Maybe we can get them out and moving more. So we thought we could add that to the booklet. So all in all, there is room for improvement, and we're still learning every day of different things we can add to the booklet. In conclusion, I really like being a part of the heart failure clinic and getting to see how patients are being cared for and treated outside the hospital setting. The nurse navigator on my unit happened to be my preceptor. Her name is Melissa Donaldson, and she helped me see how this transition can be beneficial for patients that are in heart failure. She even helped me develop a better communication skills on how to educate these types of patients, especially when it comes to the medical jargon. I'm so used to saying things now. Being a nurse, you use certain terms and certain phrases that not every person understands. So she helped me kind of dumb down my language a little bit to help get these patients to understand exactly what it means to be in heart failure. She also showed me the key points I need to focus on when it comes to discharging the patient and what I need to teach these patients and what I need to reiterate, like weighing themselves, making sure to check for any kind of swelling, stuff like that. She helped me really understand the importance of teaching. I also liked being a part of this because it helped me make a kind of a camaraderie pact with the fellow nurses on my unit. We were able to kind of come up with new, fresh ideas to help these patients stay outside of the hospital, get them not to be readmitted in 30 days. Especially when it came to that fluid restriction and those physical activities, we were able to come up with new ideas to add to that booklet that we give to patients. So all in all, I really appreciate this experience, and I hope that you all like the slideshow presentation. I hope you all found some information that can help you when you educate your patients. So all in all, thank you and good luck out there.